I've been suffering with vascular disease since the inception of my diabetes problems, but they manifested themselves in probably 1998 when I started requiring digits to be removed.
Both in terms of the individual interactions, but also the longevity. We've grown together. When we first met, we were both young professionals and setting out on our way, and then we've had children the same age. It's been a great relationship for both of us. And of course, the last few years he's been really giving back. Not that he needed to, but just giving back to the other patients on the floor by being there. And I can tell you time and time again, people come up and say how helpful it was to have Glen come in.
Dr. Campbell was more of an inspiration in that he never allowed the thought to creep in my mind that I won't be able to do something. In discussing the surgery when you're going to have something amputated, I know this won't be a problem for you at all, so I never let it become a problem. I think that Dr. Campbell, having known me to the extent that he does, it went a great deal to explaining to him what would give me the most comfort and ease me into the new situation of operating with a prosthesis. We had small children at the time, and David was aware of that. But by him knowing more about me personally, he didn't lead me off in a direction that was not germane to how I run my life. Caregivers have a unique perspective in that they're seeing a patient at the worst possible time, so their emotions are all right on the surface. And as long as the caregiver can wade through that and give a patient the information that they truly need, then everyone is better off.
Every time you treat a patient or see a patient, you ask yourself the question, is that what I would want from my mother or my sister or a family member? And if you comfortably say that is the case, then you're doing the right thing, because our economic interests don't always match those of the best interests of the patient, and it's something we have to remember all the time.
I can ask him any medical question, regardless of whether it involves my vascular system or even my wife had surgery recently, and I asked David's advice. What would you do were your wife the one involved? In a word, it is longevity, because we've developed a trust and a friendship. I consider myself to be it's the difference between friendship and acquaintance. I'm an acquaintance to most of my doctors, but David is truly a friend of mine.